Okay, a pelvic tilt. This is another really great low back warm up one. This is kind of one that delves into the realm of posture and how do we start to address the daily habits that we have in order to reduce our low back pain. So, pelvic tilt can be difficult for some people to grasp, particularly my male patients. It seems like women do a little bit better. They're just a little bit more aware of how their hips work rather than the men. But anyway, so this can be depending on who you are, how you use your body, how you stand, what your posture is like. There's a couple different variations of how we go through this, but I'm going to show some of the most basic ones. And then the thing that I want you to remember with the pelvic tilt is that it is a tool that you can use, and it is something that you should try to do, try to utilize throughout your day and change the tilt of your pelvis, particularly when you are stuck in positions for a long time. So when you're stuck on a recliner watching TV for a long time, when you're stuck in a vehicle driving around for a while, I want you to utilize this one to just change the position of your low back so that you can reduce the strain that you were putting on that low back through postural issues. So that's just an overarching theme when it comes to low back pain that I've noticed over the years, is that when you get stuck in one position for too long, that's when you're going to get yourself in trouble. There's no true right or wrong posture that we should be aiming for all the time. It's more about changing that posture and position of the low back to modify things as we go throughout our day. So pelvic tilt. Well, I'm going to show you in standing first, and then I'm going to lay down and show you the kind of what the exercises we do. So the idea is I'm going to roll my hips so that my low back curvature either decreases or increases. All of the motion is coming from my pelvis, right? So my hip bone's here, tailbone back here. The little roll right there. One way I like to do this in the clinic is laying down. So you can see as I push my low back down into the table. This is called a posterior pelvic tilt. I'm pushing my back down into the table. I can hold that for a couple seconds. Then I'm going to anterior pelvic tilt, roll my hips forward a little bit, and my low back comes off the table just a tiny bit right there. I'm gonna go back and forth, nice and easy on this. If you are someone who has some SI joint problems, so some issues at the sacrum, at your tailbone there, then you might find one of these positions is a little bit uncomfortable. So if that's the case, then I want you to go just to the direction that is comfortable. Oftentimes that is the posterior pelvic tilt, so pushing the back down into the table. This anterior tilt can be a little bit uncomfortable for people just because it requires you to use those back muscles a little bit more to make the motion happen. But it's one that I like to shoot for down the road a little bit. Once we get good at moving this pelvis around, I want to be able to hit both motions. So that's a really easy one. There's some variations that you can do with pelvic tilts. We can do some lateral pelvic tilting as well. I call this like the little penguin walk. You can see that in standing as well. So it's just a little lift of the hips back and forth. But this is, like I said earlier, this is a really great one to do just throughout your day to change the position of your low back so that you're not stuck in one spot for too long. It's going to take some of you a good bit of time really practicing that one to get good at it, but it's one that's really great to throw in throughout your day. So go give it a try.